It is time now for our Africa Health Network report, and joining us now is Africa Health reporter Lino Madu. Hi, Lino.
Hello, Dimiake. Hello, everyone. Well, the World Health Organization is reporting that women aged 50 and older are healthier now than they were 20 and 30 years ago. But while women's health has improved, a new WHO study finds the gap in life expectancy is widening between older women in rich and poor countries. The WHO reports that heart disease, stroke, and cancers are the leading causes of death of women aged 50 years and older worldwide. But it notes that these deaths occur at earlier ages in developing countries. The study is one of the first to analyze the causes of death of women aged 50 and more from a range of rich and poor countries. Now, joining us live via Skype from Geneva, Switzerland, is Dr. Colin Mathers, head of the World Health Organization Mortality and Burden of Disease Unit. Dr. Mathers, welcome to Africa 54.
Hello.
First of all, can you give us a sense of this new study that takes a closer look at the causes of death among women aged 50 and older? How does this translate among women in rich countries as opposed to poor countries?
Yes, well, I guess, we all have an image of people in poor countries mainly dying from infectious diseases and, issues with food and AIDS and so on. But looking at older women, which until now there hasn't been a huge amount of attention to older women in developing countries, it's quite surprising that they're largely dying from the same causes as women in richer countries: heart disease, stroke, cancers, and also chronic respiratory diseases that are associated with smoking and with pollution from indoor fires in some countries that still use a lot of wood in the kitchen for cooking. So the difference, I guess, is that in the poor countries, along with heart disease and cancer, there are still quite larger numbers of deaths from pneumonia, HIV in Africa, and tuberculosis. And so poor women in older countries are suffering from the chronic diseases that we associate with the rich countries, but also still have a lot of problems with infectious diseases.
So when we look at the steps in terms of improving life expectancy, focusing on women, then what would you say are the priorities?
Health systems in developing countries need to pay more attention to helping women to reduce risk factors for chronic diseases in middle age. And this includes not only smoking, but also high blood pressure, high blood cholesterol, blood sugar problems that can lead to diabetes. And diabetes is also one of the leading causes of death for women in developing countries. So there's a range of risk factors where health systems can do more than they're doing now. So when a woman has contact with the health system, to look at blood pressure and to, if it's very high, to try to get access to drugs and also other advice about controlling blood pressure. These can make a huge difference, and there's many developing countries where there's very limited supplies of the drugs that are useful for addressing some of these conditions of older ages.
Okay, Dr. Mathers, that's all the time we have. Thank you so much for joining us.
Good, thank you.
And that was Dr. Colin Mathers. He is head of the World Health Organization Mortality and Burden of Disease Unit. Back to you, Dimiake.
Well, thank you so much for the Africa Health Network report, always here on Tuesdays and Thursdays from Lino Madu.